Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Welcome to the Tongue Tie Experts podcast. I'm your host, Lisa Paladino, and today's guest is truly an honor for me to interview because I've been a fan of hers from afar for a very long time. Her name is Melissa Cole, and she's a board-certified lactation consultant, neonatal oral motor assessment professional, and clinical herbalist. Since 2002, Melissa has been dedicated to holistic lactation care and advancing clinical skills for health professionals. She specializes in supporting families with feeding challenges like tongue and lip ties, oral motor issues, prematurity, allergies, and low milk supply. With a background in maternal child health and therapeutic herbalism, Melissa is also an educator, researcher, and an amazing human, I will add. So welcome, Melissa. Thank you so much for being here with us today.
Thank you for that warm welcome. It is an honor. And I'm also a big fan of your work. So it's so great to have this time together today.
Absolutely. So the reason that instigated me to contact you and say, I have to have you on the book, on the, there it is. It's the book on the podcast now is because of your new book. And I'd love to dive into it. But before we do, I just want to talk a little bit about that marriage of lactation and herbalism. I think it's kind of magical. I have studied herbs myself, and I don't have a degree in it like you do. I've just taken courses, but I am fascinated about herbal medicine. So what brought you to what first?
Yeah, that's actually a good question. I was actually interested in herbs before lactation because I was interested in some alternative healing principles. Given my own health experiences as a younger person, I suffered from terrible migraines, was not getting relief through allopathic care despite doing everything they told me to do. Anyhow, I did find that herbs were very supportive for my own health, and I went down a deeper dive into studying them before I even had kids or even probably knew what a lactation consultant was.
Right, right.
I became interested in plant medicine, and then as I worked more in lactation, it really is a natural dovetail because there's so many issues where there aren't a lot of pharmaceuticals for lactation or milk supply related issues. And so herbs fill a gap in a very personalized way for, I think, a lot of individuals looking for support that are interested in exploring herbal medicine. So I think it naturally kind of fits into lactation because there simply aren't a lot of pharmaceuticals for certain aspects of milk production support.
I
we have a few,
totally.
we don't have a lot. So,
right. So I
yeah.
love that. And I also, as you're saying this, I'm thinking to myself, herbs are a traditional way. And the word traditional can be used different ways, but I mean like really traditional.
Yeah.
Like as a midwife, when I study the way midwives used to practice, midwives were the herbalists way back in the day, right? So there's the other marriage of like, let's go back to basics and we always want the evidence, but sometimes it's the experience that's been passed down from granny midwives to their families to other generations, right?
And still, over 80% of our global community uses plant medicine as a primary form of care. Sometimes we tend to think like, oh, is that a fad or is that a quaint folklore practice? And like, no, this is a live, living, vibrant practice around the world. And in other countries, herbs have way more funding for research and study. So not everything is always translated into English, but actually, we have a robust body of evidence around a variety of plants. And in fact, 40 to upward of 70% of our current pharmaceuticals are based on botanical origins, right? Whether you're looking at aspirin or certain cancer drugs, like so many things come from a plant origin that was actually derived not just by somebody finding something in a lab, but by traditional use of a plant guiding that knowledge to be like, what is it about this plant that we should study more and maybe, isolate certain constituents from? So, current pharmaceuticals, are not a huge step from plant origins in many cases.
Yeah, that's really interesting because if we take like, I think, and this is just my worldview of it, if somebody discovered that a plant had something in it that could help, say, headaches, they don't want to sell the plant. They want to isolate that chemical, make it into a chemical way that can be reproduced economically and sell it. So if we go back to the basics and go right to the plant, it's a little bit more direct, right? So the book got me so excited because, and the book is called Herbal Handbook for Perinatal and Pediatric Wellness. There it is. Yeah. Not everybody will see us when this podcast is released, but I will definitely have the link in the show notes and we'll pop it around Instagram too when we post about this episode. It's a gorgeous book. I just want to say that, like, not only is it filled with, with so much important information, but the pictures, the monographs are just lovely. So that must have taken quite an effort.
Thank you. The origins of the book itself, I have a database. So it's a, app or computer based. And so if someone's working with a patient somewhere, they can kind of look up in the app, about an herb, is there any contraindications, herb drug interactions, etc. So the database in kind of virtual form has been a labor of love for the past few years. And out of that, I had a lot of people, who like to hold a book in their hand and they're like, well, the app is great and we also want a book. And so the book was developed sort of out of the information that I had created into an app. So a lot of this has been sort of a long gestation, but it's been developing from my database into the book. And I'm quite proud of it. It is exciting to see something, in print and be able to kind of flip through it. But I really felt like we needed something as evidence-based, as we can find for many herbs, to be a source where clinicians, parents can look up and say, what are the safety ramifications? What are some herb drug interactions? What do we need to know about this herb and this person's health conditions? So they can make a personalized, informed decision around what they're going to put in their body.
And, one of the, there's a couple of points that I don't want to forget to mention,
Okay.
because this podcast goes to all different levels of providers
Mhm.
and parents who may not know anything about this. And in general, in lactation care,
Mhm.
there is a lot of, let's put it this way, there's an absence of knowledge about how medications work in pregnancy and
Mhm.
breastfeeding versus pregnancy. And that's just medication.
Yeah.
Now we get to herbs,
Yeah.
and it's a whole different ball game, even though it really isn't.
Yeah.
So, give me your best description of how it's different to take an herb in pregnancy than it is in breastfeeding. And because I get a lot
Mhm.
of fear around doctors or
Yeah.
other medical providers who don't understand how milk is made, just
Right.
say, oh, no, don't use anything when you're breastfeeding.
Yeah, absolutely. I mean, just like a medication, we would hopefully, think of it differently in pregnancy and in lactation, and different, parts and different, physiological actions happening there. With herbs, I mean, we do have some databases and some resources that if we're looking up, a medication over the counter or prescription, we have some resources we can turn to. The resources that have existed for herbs are way less robust, right? You look up something in one of these more pharmaceutical based books and it will say, well, just don't take that while pregnant or lactating, when that is really from a fear base and a lack of understanding about the herbal pharmacodynamics and pharmacokinetics of certain plants. So I think that when we turn to the herbal information and then we're able to really look at what do we know, what do we not know, what have we seen in animal studies, in human studies, the same ethical principles apply when we're studying an herb in a pregnant, a lactating, or a pediatric population. You just can't go around getting IRB approval to study things willy-nilly in a vulnerable population. So much of what we have is from animal studies, case studies, etc. But the same is true for pharmaceuticals, right? So
Yeah, absolutely. But the other thing that I think is important for people to understand, that there are things that aren't safe in pregnancy that are safe in lactation.
oh yes, absolutely, yes.
Yeah.
Yeah, and I mean that's true about so many things, right? Even
Mm-hmm.
in terms of what people could eat or drink, right? You may not want to
Right.
indulge in sushi when you're pregnant, but once the baby's been born, go for it. And that is true. So we're talking about things crossing through the placenta. It's very different than how things would cross over into milk. One thing we don't know about a lot of plants is the relative infant dose. Like, what is the
Mm-hmm.
potential of something passing through milk? We do have a few studies, and in fact, countries like Italy and other areas do a lot more research around like lactation and herbs. And so I do have some studies that look at milk samples that have been studied to see are there any of these plant metabolites left, and most of the time the answer is no. But
Mm-hmm.
it is something where it is different in terms of pregnancy safety, because then
Mm-hmm.
we're worrying about a developing embryo versus lactation safety. So we do want to really be clear. And I do think, I address that in the book, different things that are considered safe in pregnancy and then lactation. So
Mm-hmm. Yeah.
certainly you don't want to lump them all together.
Right, right. Because I think that sometimes they are just lumped
Yeah,
together. Like every
absolutely.
medication says,
Yeah.
do not use if pregnant or breastfeeding, or discuss with your
Yeah.
doctor. And they may call the doctor, at least around here, if they call the
Yeah.
doctor's going to say, no, don't use it.
Don't
Either
take it.
that or the
Yeah.
opposite. Oh, it's just herbal. It's fine.
Yes. And we know just
Right,
because something's natural does not mean it's safe or that it's the
right.
right thing for that person. Um, And so it is my hope in having conversations like this and putting out a book like that for clinicians to have some awareness that herbs absolutely can be a therapeutic option for many individuals, but we still want to be mindful. We want to be as safe as possible. And ideally want to get our information from herbal sources that look a little deeper and don't just say, don't do that or do this in particular time span.
Right. Yeah, I was particularly impressed when I read your bibliography and your resources and all the places
Ah,
that you have combed through
yes.
to get us this concise
Uh,
information, because I know, having studied herbal medicine myself, it can be quite overwhelming and confusing. because not everybody agrees. This study says one thing, this study says
True.
another, just like
Yeah,
medication, same,
absolutely.
similarly.
Yeah.
Yeah.
And oh, go ahead.
No, so I was just going to say, a popular post in the local breastfeeding
Okay.
groups that you know, is it safe to drink herbal tea when pregnant? Like, as if there's something, you go to the store and there's something called herbal tea, right? And that's it. Like, and herbal teas could be anything, right? So,
Anything. Yes.
yeah,
I mean, obviously, you want to know, well, like, what kind of tea is it? Is it just
right,
some flavored black tea? Is it a blend of actual, you know, herbs, leaves, twigs, berries? Like, what is it from the tea? I mean, I think a lot of things with just like a cup of tea, most people are going to hurt themselves. It's not really a therapeutic dose. But I think that in pregnancy, I mean, it is a time most people are a little bit more aware of what they're putting into their body, evaluating, is this safe, is this not safe? I think if it, then there are certain herbal teas that are marketed for pregnancy, right? They're usually full of mineral-rich herbs that would be fine and not contraindicated for most people. But I think it is a time where most people are sort of trying to be aware of, is this a safe option for me? So an herbal tea, that is just kind of generic because we want to know what herbs are in there.
right.
I think most of the time, like a bag of tea is not going to cause harm, but if it's something someone's regularly drinking and they're not sure, that would be a good thing to kind of just cross-check and say, like, is this okay for me and for
Absolutely.
pregnancy? Yeah.
Yeah. So a lot of the like marketed herbal teas have so many ingredients that there's so few that are in enough quantity that will even give a good effect usually.
And even in capsules. So even when people are buying like an herbal blend of capsules, and the bottle might say, take one capsule daily. And it's got, like 29 things in it.
Right.
And so really in that sense, you're taking like a homeopathic dose of the plant. You're not really taking a therapeutic dose. But I think a lot of times labeling is more from a liability standpoint, right? Like no one's going to hurt themselves with one capsule. So that's pretty safe to put on a bottle. But on the flip side, when people take, one capsule and they're like, well, I took the herb, it didn't work.
Right.
Because they're not taking enough to really be a therapeutic dose and cause change in the body. So, I mean, I think that if someone is serious and they're wanting to utilize herbal medicine, connect with an herbalist, connect with somebody where they can kind of give you some resources and some parameters around what therapeutic dosing would be if you're actually trying to, support a condition or something.
And also herbs are so specific and individual, right? So like I know when I was practicing more women's wellness, if someone came to me with a condition, there wasn't a standard, well, if you have this, you should take that. It was more like you have this and you have that and you're a little bit this and a little bit that, and I would formulate something for them. And I know you do that in your practice as well. And I kind of miss that because that's like an art. That is
the heart and the art of it. But one thing I am glad to see the changing a little bit, even in like lactation. Let's just think about like that scenario with herbs for milk production. Used to be people say, like, oh, you have low milk supply. Well, take fenugreek and blessed thistle. Right? That's the thing to do. And now I love that we're seeing a little more nuance. Like, all right, let's address like what is the root cause of this person's low production? What herbs are going to best support these different, areas of milk production? And I mean, I feel like I'm a part of that in terms of educating others about like what herbs should be personalized. But I love seeing that actual awareness grow where people are thinking in a more personalized way of what does this person need?
Yeah. I love that. And, I think milk supply issues are probably, in my view, the biggest reason that people say, well, I can't take medicine. So what herbs are there? What supplements can I take to increase my milk, right?
And particularly in the United States, I mean, we have access to really few options that fit most people. So people do look towards herbs to fill a gap. And an interesting thing there's a colleague of mine that invited me to be part of a study she's doing, and it has to do with some herbs. And it's great. I'm excited to be a part of it because I want to see the body of research grow. But an interesting thing in terms about milk production and herbal support, as we're doing this study, we have a wonderful study design, and we had it randomized. So some people would get the herb, some would get placebo. We'd get their prolactin drawn. We would look at milk production levels on days,
You're getting me very excited.
I know. We have great study design, Lisa. And then, what really has stood out to me in trying, we're pivoting at the moment, but in trying to get people to sign up and say, okay, would you be interested in being part of the study? No one wants to risk getting the placebo, right? They just want to do whatever they can to spend. So in creating this wonderful herbal study design that I thought would be really phenomenal, I forgot the human element of when someone is dealing with milk production issues. Nobody wants to be a guinea pig or risk not getting the real thing. So we're having to kind of pivot our study design, but it has been a real eye opener. And we can get research, done. We can, get people interested in this and start to build the body of evidence. But we also have to think about how we do that with real people in a vulnerable time. Yeah.
Right. It's the same with tongue tie research, right? Like we can't.
Which I've also been a part of.
Right. I know. Yeah. And we can't deny help to a baby that needs help.
Yeah.
Right. And that's not ethical. So that's one of the reasons why you'll never see, I don't know. We'll never see that.
We'll never see a randomized, long-term, study where we're looking at people through, a long duration of time. But this is why different study designs exist. But it's also interesting when people say, well, we want more research. I really encourage them to think about study designs, and getting research in a vulnerable population is challenging, and we have to be really appropriate with how we do it.
Yeah. So. And a lot of the times those two vulnerable populations overlap. The low milk supply parents with the baby who has oral restrictions. So it just makes it more challenging. Yeah. So, I think it's amazing. And you, in passing, mentioned the herb fenugreek. To me, fenugreek is like a controversial herb.
Oh, my gosh. It's such a topic. I feel bad. Fenugreek, it's a bad rap. It's an awesome herb. It can do a lot of wonderful things. And it is an herb with a contraindication list that might be a little longer than some other plants. But I do hate to see people kind of throw it under the bus and say, oh, nobody should take fenugreek. It's just that's the take-home message. Herbs should be individualized. There's some people where fenugreek is going to be super supportive, nourishing, helpful, and some where it's not going to be supportive for their milk production needs.
Yeah. I've got to be honest with you. It hasn't been my favorite herb. And I had some poor results when I first started using it, and I felt like, what's going on here? So then when I heard that it's not for everyone, and it started making sense to me, and then started using that more root cause approach. Like, why does this woman particularly have this low milk supply issue? Maybe she needs some adaptogens. Maybe she needs some, whatever, iron.
And
maybe
that's where that personal. And I also don't want, people that are maybe kind of new or interested in herbs to think they need to know so much about everything or need to know about every exotic plant in the far corners of the earth. Just getting to know, 2 or 3 plants that could be multi-purpose can be such a good foundation. So if we are sticking to the theme of milk production, someone really getting to know moringa, or really getting to know shatavari, or really getting to know just 1 or 2 things, and then kind of building from there. I have a lot of people often ask me about, well, what about this rare herb from over there, this rare herb? And I feel like we're always looking for the next best thing. When sometimes I'm just like, well, what about chamomile? That's
right.
That could be an amazing plant. We tend to think sometimes simple is less effective, and that's just not true.
I'm gonna laugh because I always tell, if my kids complain about something, my first line is always, are you taking chamomile tea? Just drink some chamomile tea. And my kids are like, Mom, enough with the chamomile tea.
Right.
But something so simple can be so healing, right? With so little side effects.
And exactly. And I could also pull up 3 different randomized studies on chamomile and significant antidepressive or anti-anxiety effects. So it can be simple, and it can be a wonderful healing plant ally, but it also can be hardcore medicine for many individuals.
So if you had to pick 3 herbs
Oh,
that are your top go-to,
yeah.
and now I'm putting you on the spot,
That's okay.
but just like, and forget about pregnancy and lactation, just in general,
Okay.
like your
Yes.
favorite plant allies, your top 3,
Yeah.
what would they be?
Well, first for me, I guess I'm going personal, but first for
Yeah.
me, it would be Schisandra.
Okay.
Schisandra, it's a berry. It's a little. We usually dry the berry, use the berry. It is such a wonderful adaptogen. It really helps stamina, nourishes thyroid, liver. Like, it just kind of is a workhorse. It works for you and really helps you be resilient against stressors. So it's also my favorite for postpartum night sweats.
That's interesting.
Perimenopausal night sweats. It works quite well there too. But it can definitely be probably top of my list. After that, I might go with milky oat top as a nervous system
Nourishing,
supporter.
right? Very
So
nourishing.
nourishing.
Yeah.
And if I only had to pick a third, I don't know. I guess I would probably go maybe with milk thistle or Chinese skullcap.
Okay.
Maybe I go with milk thistle in that I do feel like many people need some liver love and support, and our livers work really hard for us.
Especially in the world we live in, right?
Yeah, absolutely. So those would definitely really be up there, but asking me to pick 3, it's like, what 3 herbs would you
sorry.
take to a deserted
It's
island?
like, what's your favorite child, right?
Yeah, right. Well, we all have one of those. I'm just kidding.
So my ultimate and most suggested herb is motherwort. I love motherwort.
I love motherwort too.
I mean, I almost, matter of fact, I usually take some before I record. Like I was like, oh shoot, I'm talking to an herbalist and I forgot my motherwort downstairs. So like
motherwort
that's
is
my
so
favorite.
beautiful.
She just makes me really happy and feel settled. I talk about it like I feel like I took a deep breath after like it reminds me to just okay.
Motherwort is so good. It is often considered the herb that mothers the mother, but so good for just your heart rhythm, your soul. It's good if you feel a little prone to anger or stress. It's very nervous system supportive. So I love motherwort.
And I feel like of all the herbs I've ever suggested, that's the one that people cling to most. You make recommendations. I send out like recommendations for my patients. Take this, and the motherwort is the one they're like reordering because that's the one that they've attached to, for anxiety.
I feel like that would be a very supportive herb for many different issues.
Yeah, I feel like it helps relaxation. People who are tense nursing and are having trouble with letdown.
Absolutely. I use motherwort a lot for that.
Yeah. Anyway,
beautiful.
They're all lovely. I haven't spoken about herbs in so long. This is like really, making my heart happy. So thank you, Melissa.
Oh my gosh, you're welcome. And it is so nice to kind of look at other fields. And I mean, when it comes to like perinatal health, having more tools in your toolbox, and whether or not a clinician wants to take a deeper dive in learning about like what herbs might be appropriate for what person, even just having the resources, being able to like pick something up, look up, is this safe for this person? Yeah. Even that is a really good start, but having more tools in our toolbox is never a bad idea.
Absolutely. And you want to be prepared. As a clinician, you want to know as much as your patients.
Yeah.
So if you have patients who are dabbling in herbs or treating themselves with herbs and they ask you something, you want to be able to say, oh, you know what? I may know that, I may not, but let me look it up. I have this resource. So your book is going to go a long way.
Well, I hope it is a resource. Yeah. Widely.
I have a dental friend, and a lot of dentists listen to our podcast, right? So
yeah, of course.
I have had dental work, and my dentist knows that I don't take anesthesia.
Okay.
I use herbs, right? So like that's a possibility. He's like so worried. And I just say to him, the same way you say to somebody who's having natural childbirth, don't ask me if I'm in pain. If I am, I'll tell you.
Yeah.
He struggles with it and he's so cute about it,
interesting.
And then I'll use anti-infectives before and after that are herbal based instead of using antibiotics. Now, I'm not telling anybody never to take antibiotics, but I'm just like saying that this is my experience. They're so powerful and so strong and many of our antibiotics come from the natural world
Yes.
originally.
Yeah.
So I've been able to do that and impress my dentist. So dentist, if you're looking for another way.
Yeah. And also being able to, if a client or a patient comes in and says, can I take this? Is that safe? Rather than just giving a blanket statement of like, yeah, I don't know, don't take it. Being able to look things up and give them some personalized information.
Yeah.
Sure.
I think the reflex answer is always, if you don't know, you say no. That's a good point. And I think we should be getting beyond that for sure.
Yeah. And nowadays, I think it's so common, depending on especially where you live, for really the clients themselves to come in either on already a bunch of herbs, already taking things because they're wanting to fix a problem, or they're really saying like, can I take this or that? And we want to be able to have some quality information to turn to.
Excellent. And the book has beautiful pictures and it talks about pediatrics too. It's not just for nursing and pregnancy. It's about pediatrics, which I think is important. Mm-hmm. And you have a section where you say where it's safe, a monograph. For those who don't know what a monograph is, it's all about the actual plant and what are the contraindications, what it's good for, and who shouldn't take it and why. And it's just beautiful. And there's some nice pictures in there.
You usually can see a box where it has names, some indications of when to use it, potential contraindications, some available evidence. So usually, and there's a good one in there for motherwort.
That and ashwagandha I take my whole life. Like I'm just like, my whole family is on ashwagandha. I'm like, just take it. Can't hurt.
And funny thing is, there's only a couple herbs, ashwagandha and rhodiola, that every once in a while I'll meet someone who they'll have a paradoxical reaction. That
really
it'll be an opposite reaction for them, where they actually kind of get hyped up and a little, they're not, their nervous system is not calmed. It's almost a little more amped up. But that's really an outlier. But I think it is good to know, like if someone tries an herb and they feel like it's not giving them the response they want, it's like there are professionals like myself or others that could kind of help them find what would be best suited for their body.
Because you would know, well, if that didn't work for you, this might be a better option in the same category.
Exactly.
Yes. And then we could get into the whole Chinese medicine principles of the warmth or the cooling.
Absolutely.
And so some people need different aspects of that, right?
I do list some energetics in the book. And, for people that are a little bit more knowledgeable of herbs, they understand that like some herbs are moistening, right? Some are drying. So, I think it makes sense if someone's already having a really dehydrated sort of constitution, we wouldn't necessarily want to add more like dryness. We might want to add some nourishing herbs that are a little bit more moistening. In fact, shatavari is my favorite for postpartum vaginal dryness. Just when estrogen might commonly be recommended, but we know it might not be super great for milk production. There are botanical options that could really be supportive for many.
Right. Yeah, shatavari is on my shelf for sure.
Yes.
So,
me too.
Yeah. So, it's wonderful to know that there are options. There's one. It's just magnificent to have somebody dedicate their time and energy to putting together this list. So, I want to thank you. And the other thing I want to say is, some of the things that we've mentioned today sound like insider information, but you don't have to know. You don't have to have a degree in herbalism to be able to get the benefits from some everyday herbs. And the book will definitely help that. So it's Herbal Handbook for Perinatal and Pediatric Wellness. Lots of evidence in there, lots of information. I recommend that it be on everybody's bookshelf, whether you're a clinician or a parent or anybody that, wants to do a little bit different than what the medicinal world is telling you about what can heal you, because herbs are very healing for everyone.
They are, and they too have evidence, and I can talk on and on about that. And even if individuals or clinicians are needing consultations or support, I'm pretty accessible. It's lunalactation.com if someone needs to connect with me or resources for their own community.
Perfect. That was going to be my next question. How do people best reach you? So it's lunalactation.com. And I just recently, Melissa, I had a dog named Luna. and she
Oh,
passed this past year.
I'm
So
sorry.
every time I see your name, like I just I feel
Oh,
it. Like I love that name. Luna is a
yes.
beautiful name. And I told you before we signed on, I wanted to use Luna as my name, and I
Yeah.
did a search and it was already taken. This is going
Well,
back like,
and I appreciate that because there have been a few who haven't done a search, and I've had to gently
no.
say that's
Yeah.
my name. But I'm sorry to hear about your sweet fur baby.
Yeah. I have a new
Yeah.
baby. I have a new
Okay.
baby, Oliver. He's really cute.
Oliver.
I can't wait until he's trained enough so that I can have him like on my lap like
Yeah.
I used to do with my older dog.
Oh, yeah.
But anyway, Melissa, thank you so
It's been
much
a
for your
pleasure.
time. It's been a pleasure. LunaLactation.com, and check out, I'll put the link to the book
Thank
in the
you.
show notes, but you can
Yeah.
Google it, and it's on your website as well,
It
right?
is on the website.
And it's definitely
Absolutely.
affordable. It's a needed resource for everybody's
Thank
bookshelf.
you.
Thank you so
appreciate you.
much.
I could talk herbs all day, Lisa. I appreciate your time.
Take
Thank
care.
you.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue-tie Experts Insiders. It includes monthly online meetups with me, Lisa Paladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.